Recording.
All right, we're going to cover the King Airway insertion, along with probably the most common problems encountered in the field. There are studies that show failure rates with the King approaching 25 to 30%, and these failure rates have been associated with insertion of the King. We're going to cover specifically insertion techniques and trying to get past what may be the cause of some of these failures. The King insertion technique videos are all over the internet. You can find them quite readily, and so we're going to address the problems we see. The first part of inserting the King Airway is jaw displacement. What's often taught is, and you can see this, is people are first responders are taught to grab the jaw like so, and effectively they're grabbing the teeth and the angle or the edge of the jaw and lifting up and then inserting the King. The other way people are taught is a pretty common one from inserting an OPA is using the cross finger technique to open the mouth and then placing, for example, an OPA. These are fine for an OPA, but if you're inserting a King, your big risk is displacing the tongue and the associated structures posteriorly and inferiorly. So if I just lift up on the teeth and I shove the King in, even with the sideward cant, there's a good chance I'm going to hook the tongue, push it down, and then when I inflate the cuff will actually pin the tongue or the epiglottis over the vocal cords, over the glottic opening, resulting in an airway failure. Because first responders, a lot of folks have concerns about sticking their finger inside, we're going to explore a way to get past it. But for the person who is not concerned about putting their fingers inside, the proper way to capture the tongue and the jaw is to really almost bury your thumb inside and try to catch the back of the tongue, almost like you're fish hooking the tongue. With the tongue out of the way, the jaw elevated, now you can easily slide the King all the way in and proceed with inflating the King and finishing the process. When you bring the thumb to catch the jaw, if you have two people, it's ideal to insert the King all the way in, maintain control of the tongue, and then have your partner come in and inflate the cuff. This way you know you felt it. The tongue is being captured and pulled anteriorly and superiorly, and the cuff has been able to do its job and basically inflate behind the tongue and the epiglottis. Another way of placing the King is if you have a BLS airway established, you have the OPA in place, is to leave the OPA in place and let the OPA do its job of displacing the tongue. Insert the King inside here, behind the OPA, inflate the King, and as you can see, everything's been pushed forward. Then remove the OPA and continue with the King placement. For the provider allowed to use a laryngoscope blade, a large Mac or a Grandview blade is ideal. You go ahead and place your blade, and we're not trying to visualize the vocal cords. We are actually bringing the blade all the way in. It's called a shoehorn technique. The pharynx basically funnels down. So all you have to do is insert the blade all the way in, lift up a little bit here to displace the tongue, insert the King behind the blade, have the cuff inflated, whether by you or your partner, withdraw the blade, and then proceed with the placement. Using one of these techniques will maximize the success rate of King insertion by eliminating the number one risk associated with King insertion, which is either the tip winds up bending into the opening of the vocal cords, the glottic opening, or pushing the tongue behind to where now when you inflate the cuff, the tongue would be, for example, here, and now the tongue is forced into the glottic opening. This technique, or these techniques I've shown, work extremely well with the combi tube as well, especially, again, the shoehorn technique. Insert the laryngoscope blade, place a combi tube, inflate the cuffs, and all the blade is done, just as with the OPA, is kept the tongue pulled upward and forward and out of the way. I hope this helps.